You're listening to In Network, Nordic's podcast series where we explore healthcare and technology with experts from around the globe.
Hello and welcome to the In Network podcast feature, Designing for Health. I'm Nordic's Chief Medical Officer, Dr. Craig Joseph.
And I'm Nordic's Head of Thought Leadership, Dr. Jerome Pagani. We recently sat down with Evan Heigert, Creative Director at Wolters Kluwer Health. His work centers on Emmi, a new type of patient engagement tool.
We talk about Evan's background in journalism and advertising, his current work with Emmi and how it fills in the gaps in healthcare, and how impactful content can create win-win scenarios for patients and clinicians alike.
We also discuss how best to meet patients where they're at, how real-world design touches can have outsized impacts, and the growing prevalence of tiaras in healthcare. Yep, I said tiaras. Let's plug in.
Hey, Evan, welcome to the pod. We're happy to have you.
Hey, Craig. Hey, Jerome. Very happy to be here as well. Thanks so much for having me this afternoon.
Now, when we did some preparation, it turned out that we found out you were an English major with a print journalism focus. But very quickly, you saw the light and you pivoted to advertising, or as you called it, storytelling with an agenda. So tell us about that. How did you go from kind of an English major journalism person to advertising?
Yeah, you took the words out of my mouth. So I've always been, really fascinated by storytelling in a lot of different formats. So in my early days, I was really excited to kind of pursue a career in print journalism. Many moons ago, when that was a career choice that led to a lot of possibilities. Spent a really great series of internships and times really learning that world, but realized that, what really excited me was just the ability to be able to tell a story, to find that hook, to find reasons that people want to engage with those stories that lead to behavior change or things that they want to act upon. So had a really great mentor that said, hey, you might really enjoy the creative aspects of advertising. So took that as an opportunity to kind of pursue copywriting and creative writing for a series of advertising agencies and brand side organizations. So as you said, I really feel as if advertising is storytelling with an agenda. You're trying to find that authentic story that connects with your audience and encourage them to do something, buy something, learn more, connect with your brand in a way. So that was a really exciting place for me to kind of start my career.
And today you're at Emmi as the creative director for patient engagement. So tell us, how did you go from college to Emmi, and what do you do today?
Yeah, absolutely. So along that journey of being in advertising, being in marketing, I came into organizations that were working in a variety of industries. And the one area that was certainly a bit intimidating to me, but also very exciting and interesting was healthcare. And so I really found joy in working with clients that were, as I saw it, doing well by doing good, being successful in the space by helping others in the healthcare space. And so as I thought about what's the next step in my career and how I could pivot my experience in creative storytelling and creative direction into the future, I thought I wanted to seek an organization that was doing exactly that. So I have the great honor of being creative director, overseeing Emmi, the team that's working on design, content, experience for enabling patient engagement and patient education as part of Wolters Kluwer Health as our larger organization.
So the goal at Wolters Kluwer is to deliver the best care everywhere by bringing the patient into the care team. Can you give us some examples of how that works in a sort of practical sense?
Yeah, absolutely. So as part of the larger Wolters Kluwer Health organization, Emmi works with our sister company UpToDate, who is a leader in clinical decision-making and clinical education for care teams around the globe. So where UpToDate is delivering the best evidence-based, most recent information to doctors and care teams, we harmonize with that content. So we're actually at Emmi our focus is to take that information, take that content that a doctor or a care team or a nurse is looking at, and think about how we translate that information so that your average patient can engage with it, understand it, comprehend the content, and act upon that in a way that patients are actually brought into part of that care team journey. I think that's one piece of the puzzle that sometimes gets overlooked. We're thinking about ways that we're supporting care teams and clinicians and the nurse practitioners and so forth. But really, it's important that the patient feels empowered to ask the right questions, engage in shared decision making. And we feel very passionately that at Emmi, our goal is to kind of bridge that gap between the patient and the care team. So they're all playing off the same playbook. They're using the same concepts in conversation, even though for a patient, we're maybe phrasing or sharing that content in a slightly different format.
Can you give us an example of an Emmi program? Like, what does that mean?
Yeah, absolutely. So at Emmi, Emmi is a suite actually of patient engagement and education tools. So we create a variety of content in different formats. Our vision is to always meet patients where they are in their healthcare journey. So that content could come across as primarily text-based leaflets, let's call it, whether that's digital or print-based. I think a lot of us have experience going to the doctor and leaving the doctor's office and getting a printout of different things we need to know about our conditions or our health or how to improve our wellness, things like that. So at the base level, we create content like that based on the written word. I would say the next level of engagement is that we translate that content into multimedia programs. So short way to say that, video with interactive components built into it. So taking that information, applying a real human voice to explaining that information, applying a very unique design skill set, illustrated approach to bringing that content to life, and then delivering that in a variety of formats. So patients can engage with it on mobile devices, on their laptop, in a bedside environment. So that's what we call our multimedia programs. It's kind of the core of the Emmi engagement strategy. And then further down the line, we can also enable content over the course of time through longitudinal care, keeping up with patients that maybe have a chronic condition or are discharged from the hospital after procedure, make sure that we're delivering them content and information over time so they're building better behaviors. So that's kind of the scope of the Emmi solutions. Like I said, my team really focuses on that multimedia content because it's so nuanced and delivers that engagement level that we really hope to meet patients with.
So it's kind of like the old patient handouts that we used to get, or that I used to give to parents. Hey, your kid's got strep throat. Here's a 1-pager. You've taken that and put it on steroids. I assume it's also, things like pre-op and post-op guidelines, that sort of thing.
Absolutely. So we have content that approaches a wide range of conditions, procedures, lines of service, care conditions, et cetera. So, a great example, as you're saying, is we can deliver content prior to a procedure, let's say a colonoscopy procedure that helps a patient better prepare for that procedure, reduces their anxiety about what's going to happen, gives them better understanding of the anatomy that's going to be looked at, how they can prepare for that procedure so they can make that a successful procedure and then come out of that procedure and, benefit them in the long run. So the benefits are certainly to the patient. It's just being better informed, being able to ask those questions, talk about alternatives and solutions and decision-making with their care team. For the care team, it's very helpful because we're serving almost as a proxy to the care team. We know how busy the care team is, how stressed and overburdened doctors and nurses are today. So we are able to deliver that little bit more personalized information and time with a patient that helps make sure that they're understanding the concepts we're delivering to them in a very, very empathetic way that kind of meets them where they're at.
Let's dig into that phrase a little more, because I love that. The idea that the Emmi ends up being a proxy for the care team. So it seems like what you're trying to do is create something that ends up being a win on both the clinical care team and on the patient side. So can you tell us how Emmi serves as that intermediary, and what's the gap that it's filling in healthcare?
Yeah, I think that's a great question. And I'm preaching to the choir here, of course, but I think some of the challenges that we see in the space is that one, as a patient, you have less and less time face to face with your care team, right? And in fact, so many times that personal interaction is being replaced by digital experiences. We are a digital experience. All of our content is generally served um, in a self-service model that a patient would be able to watch it on their phone, on their laptop, in the bedside, take home and engage with it, right? But what we want to do is kind of find ways that we're delivering that content in a way that feels as personalized as if they were able to connect with their care team face to face. So that's one key gap that we're trying to solve. The other, I think, is that quite honestly, there's just more information out there than ever before. I think we all know that as consumers in the world, and with more information comes with it more misinformation, right? So what we try to serve is, because we have that harmonization with a doctor's very trusted tool and up to date. We gain that trust from the care team, that they understand that the evidence-based information that they're working from is being delivered to their patients. So it's building that trust, it's building that connection, it's better preparing those patients so they can come into those visits where they do have 5 minutes with a patient or so and have a much richer, deeper conversation.
And you touched on how patients are having increasingly digital experiences related to their healthcare. And we've heard that this is not necessarily a bad thing. For instance, patients are rating some doctor's notes that are generated by large language models as actually being more empathetic than their physician, frankly, has time to write. So it seems like from the patient side, they're getting a fair amount of support from their care team, but in a way that it just makes it easier for the care team.
Yeah, I think you touched on something that's really important, and it's kind of coming back to that storytelling. It's kind of the red thread that I think we follow through all of our Emmi work, which is empathy. I think that's a really important, sometimes overused, but very important concept, right? So we mean empathy by many different ways. One is, as you mentioned, there's precious little time that a patient often has with their care team. I've been in that situation where you come into the doctor's office, you're waiting for a little while, the doctor comes in, says a few things, and then he's out the door, she's out the door, and I forgot the 5 questions I wanted to ask them. Or later that day, I'm like, oh, what did that result really mean, or things like that. Emmi allows the patient to have an always on available source of information. So a doctor or a nurse practitioner will be able to deliver that content. They see a diagnosis for a patient, or the patient is engaging, is going to go through a procedure. They can deliver that content to the patient that they can watch immediately. They can take it home and engage with it later. They can sit down with a caregiver or other circle of care member and kind of review that information together. They can come back 3 days later and watch it again and engage with it. We actually have tools built in the Emmi program, and this is where some of that interactivity comes into play. Is I can take notes as I'm watching a program around my colonoscopy, for example, where like, oh, I have a question about this part of anatomy, or I have a question about this alternative, or do I really need to do this every year, or things like that. That information, I can gather that. I can come back to my next visit with my care team and ask those questions and feel more empowered and more prepared, I guess, to be able to talk about those things.
Evan, we know there's, and especially coming from advertising, there's no such thing as one size fits all information. So how does Emmi reach the patient in their context?
Yeah, it's really important. And I think as consumers, we expect our experiences in the digital landscape to be highly personalized and meet us where we're at, right? So I think there's 2 areas that we think about when it comes to that approach for meeting patients and their specific needs. One is approaching diversity in the content we're creating. And I mean that in several different ways. One, we have over 650 multimedia programs. We have over 8,000 print leaflets. That's a lot of content. We can't necessarily create that content so it speaks specifically to your experience and your background for every single person. But what we do is we follow the concept of universal design practices. So we use that scope of content to show as many different experiences as possible. And so diversity and inclusion plays a really big role in the way that we showcase those experiences. So that can be represented as everything from showing audiences, showing the patient from different cultural, racial, ethnic backgrounds. So using artwork that shows that diversity of experiences, but also things like socioeconomic status, understanding that not all patients have access to the same level of supplementary care, thinking about mobility levels, for if part of our content is to encourage people to find ways of moving to improve their overall health. That doesn't always mean running around the block for every patient. It could mean stretching. It could mean doing water aerobics, things like that. So we try to see a broader spectrum of diversity and showcase those experiences as much as possible. The second part of that I think is really important is just the concept of personalization. So the value that we bring through those multimedia experiences is that we can build interactivity into those videos. So a couple examples of that is, let's say we have a program around the benefits of physical movement for your emotional and physical health. We can serve up a menu of exercises you can do that serve different levels of mobility or ability levels for the patient. So I can self-select content that, if I'm in a wheelchair, I'm able to do stretching exercises that still help me benefit my heart rate and things like that. It gives you that ability to kind of self-select and self-guide information that's more valuable to you.
So you're generally creating content at about a fourth grade level. Is that where you're targeting?
Yeah. So another key challenge I think that we all can recognize is that patients are coming to these healthcare experiences with different levels of understanding and different health literacy rates and expectations, right? So we strive to always write our content at a fourth grade reading level. That's by no means to dumb the content down. That's not our intention. Our intention is to find the simplest baseline and the simplest way to understand content for the widest audience. So that's important to meet them where they're at and kind of build that foundation and build on those concepts over time. Other ways that we approach meeting patients and helping them understand and comprehend this content is we know that healthcare is full of acronyms and jargon and things that we use every day that maybe the average patient might not understand. So we try to use everyday language as much as possible. Instead of saying bowel movement, we'll just say poop because that's the way that people understand it. And I'm sorry I'm on a podcast talking about poop, but that's part of life, right? And so we really try to just use everyday common language that helps patients really understand the things that they're engaging with, so they can just feel more equipped to be able to have those conversations in an authentic way with their care team.
No need to apologize for that concept. We spend a lot of time talking about that here on the pod. So how do you then? So I totally get what your goal is, but sometimes that's got to be difficult, right? Because you're going to be explaining and giving complex, recommendations. Have there been times where you're just like, yeah, we got to use this word because there's really no other word, or we try to simplify it to the point where we're just using common language and it just didn't get across, so we had to kind of pivot, back it up, and change.
Yeah, absolutely. I think one of the things we think about at Emmi is when we're approaching building our content, we think about the art and science of how to develop content. So what I mean by that is there's a science to the way that you need to deliver accurate and evidence-based information in the right way, in the right order that a patient's going to understand it. But there's an art to how you can deliver that as well. And so our multimedia content is composed of kind of 4 different components. It's It's the words and the content that we use. It's the voice, the actual human voices that are delivering that voiceover and that content. It's the illustrated artwork that we use to explain those concepts and put those in a visual format. And then it's the user experience that we build, that how we deliver that to the patient. So we can, especially when there's really complex concepts, we can kind of pull on those different levers to help make that information easier to understand. So an example of that is a lot of times we will use visual metaphors to help break down and explain a concept that's either very complex or sometimes downright scary. So an example of that is if you think about an aortic aneurysm rupturing, and like how if we used realistic, if it was real life footage of that happening, it would be, first of all, very scary and very off-putting for a patient. Even in our illustrated format, to show that anatomy, that rupture happening would be, again, very scary for someone that's maybe facing that as a reality in their life. So we'll use visual metaphors such as we'll show, hey, this is very similar to like a garden hose that has a bulge in it with a little leak and water is squirting out, and how damaging that could be and how that disrupts the operation of that garden hose. So we find opportunities to kind of step back and like maybe depersonalize in some way some of those explanations, so that even when that concept is complex and we can go into it and show examples or real world examples that help them better understand that concept, we can better enhance that comprehension for the patient without scaring them to death, obviously, is kind of the key.
So there's a lot of information that you have to deliver for a particular patient. How do you make a decision about how much to deliver and what to deliver first?
Yeah, that is our day-to-day conversation in a nutshell.
Sorry, do you do it in a vacuum? Is it just you guys sitting in a room and deciding? Like, who's at the table when you make those decisions?
Yeah, absolutely. No, I think that's an important distinction. So one, we have a very diverse team that works on all this content. We have an incredible editorial team with backgrounds in clinical backgrounds in behavioral health, behavioral science. We have artists that have biomedical degrees and how to deliver and showcase anatomy and procedures in a very empathetic way. We have production artists that have spent time at places like Nickelodeon, so they bring that edutainment approach to content. We have voice artists and voice interface designers. So this plethora of skilled team members come together, and the collaboration is what's key there. So when there's a particularly difficult concept to get across, or the ordering of that can be confusing, we really lean on each other to discuss how that might come across best. So the writers might start with kind of a script of what we want to bring across to that patient. The artist might come in and say, like, hey, maybe here's one way that we could like break down that's a lot of words. How could we show that in a simpler way, or as a process in the journey? Or how could we use the voice artist to really slow down, empathize some of those concepts so a patient has time to think about it and understand it in a deeper sense. So that's how we do it within the creative group. Now, there's other stakeholders that sit at the table that are incredibly important to us. One, we have medical advisors, both from our sister company Up to Date, as well as third-party medical advisors from leading institutions across the country, many times practicing clinicians that we do regular reviews with. So we generally sit down with 3 or 4 advisors for every program we create. They give us notes, they give us feedback, help us explain those concepts in the best way possible. We use that information, we use that collaboration, and then ultimately the key part of the process is bringing it to the patient. So we have a 12-person patient advisory board that comes from a very diverse background, from socioeconomic backgrounds, racial, cultural, geographic backgrounds, that we sit down with, especially for topics that are very sensitive or culturally sensitive. We're able to put that content in front of them, have very frank discussions around what they're understanding, what they're missing, where we could maybe dig in a little bit deeper, where we need to like maybe step back on some of the complexity or the scariness of it. So those three groups are so key to developing the content that ultimately best serves that patient.
Evan, some of your content is interactive. How does that work, and how do you decide what to make interactive and what to leave static?
Yeah, I think interactivity is a key component to personalization. Again, we are always, it's another way that we deliver empathy in the content we're delivering, right? So I keep saying this, but as consumers and as health consumers, we're used to getting snippets of information very quickly and moving on to the next thing. But in the healthcare space, we recognize that that's not always the best solution. You can't explain a very intricate procedure in 60 seconds and think that a patient is going to be prepared for that and ask all the right questions, right? So a lot of times we need to expand or contract the amount of information that we're giving to a patient to lead to the best outcome for that patient, right? But we want to put the power in the hands of that patient as well. So we use interactivity to help bring the patient in to help self-guide the learning process for themselves as well, based on their previous knowledge, their extent of knowledge with that condition or that procedure, and other factors. So a recent example of that is we recently created a program around medication adherence. And we know that that's a big challenge in the healthcare space. How do you encourage patients to take their medicine in the right way and the right cadence and so forth, right? So there's a lot of challenges there that a patient could be facing. So we started that program and we took a step back and we said, how can we best serve each individual patient with this topic? And so the beginning of that program actually starts with a short questionnaire. It asks you, dear patient, as you're taking your medication, what challenges do you face? Is it the cost of the medication? Is it you not seeing the benefits of that medication? Does it make you feel bad because you have to take medication? Is it just hard to get to the pharmacy to get that medication? So we ask them these 6, 7, 8 quick questions that they're able to self-select in the program itself, whether that's on their phone, on the laptop, or in the doctor's office. And based on the answers to those questions, then we can zero in on what some of the advice that we would give them based on those challenges. So if I have all those challenges, we're going to give you a lot of advice around how to approach that. If my only challenge is that I can't afford my medication, we're going to really focus in on that information and that advice that helps you find resources to support that and the importance of doing so. So that's one way that we use interactivity and personalization to help shorten the content that we're delivering to a patient. So we know that their time is precious. We know that their attention is precious, but also we want to make it as actionable as possible. So if I'm getting only the information I need, I can go and act upon that as opposed to sitting through several minutes of information that's not relevant for me. So I think that's one important reason is like, how can we get the most actionable information to the patient in the shortest amount of time? Other examples of that is just giving patients the ability to get the information that they deem is relevant based on prior experience. So I brought up colonoscopy before. Our colonoscopy program, there's a lot to go into, and it's very important that a patient understands a lot of that information in preparation for that procedure, right? So I think that program might be 20 minutes in its full length. But if I'm a patient that has had a colonoscopy 3, 4, 5 times before in my life, maybe I don't need to know the 101 of the anatomy and what's happening in that procedure. Maybe I really just need to understand what I need to do to prep for that procedure, when I need to stop eating, do I need to take the preparatory formula, things like that. Like, what do I need to do to make that as successful as a procedure as possible? So we give patients the ability to kind of self-select, say, I've had a colonoscopy before, just take me to that prep section, give me the 2-minute rundown of what I need to do to make sure that's a good procedure, right? And so one, that increases engagement for the patients. They can decide how much information they want or not. But ultimately, we're getting the most pertinent information to that patient. So we actually see that there's real data that stands behind this. So a patient that engages with that content in any form is 50% less likely to need to reschedule that appointment because they didn't do the prep right, or doesn't show up for that procedure and needs to be rescheduled. So there's real ROI for the care team, as well as reduced anxiety and more preparation for the patient. So we think about things like that and try to put ourselves in the shoes of the patient of like what would be helpful for them to kind of self-select or guide them to the information that's valuable.
Yeah, I had imagined that there'd be just a big room with some illustrators fighting it out with the writers, and I'm disappointed to hear that you all work together along with the target audience, the patients and the clinicians. I think can you maybe consider for future reference having a big fight, like a physical fight, because that would make for a better future podcast. I'm just laying that out there now.
Well, I could give you a sneak peek into our Slack channel, and you could probably find a little bit of that drama if you really want to find it, Craig. But the ultimate goal is to best serve the patient. So I think we all try to keep that in the forefront as we're working through the best way to deliver that information.
That is fair enough. So let me ask you maybe a simple question. As you've mentioned, your sister company is Up to Date, and they're the ones that create the information for physicians. How do you work with them to make sure that all of your content is, hang on, wait for it, is up to date? How do you keep Emmi up to date so that it doesn't get behind? Obviously, it should be pretty current when you create it, but maybe 6 months later or a year or two later, it's not there anymore.
It's a pretty clever name, Up to Date, isn't it? Emmi has a little bit more nuance to it, but I think one of the ways that we do that is we're very committed to. We know how often the medical literature changes, so we're committed to an annual medical review of all of our content. So we sit down with advisors and experts in that space. Again, I mentioned 650 programs, 8,000 leaflets. There's a lot of content out there. We kind of we work hand in hand with our compatriots at Up to Date and kind of look at where is the literature changing, where can we dig in, find ways that we can improve that content, make it more accurate, but also very important, harmonize the two ends of the business. So making sure that the way that we're explaining a procedure in Up to Date in the right order and so forth, that we're able to then translate that and deliver that to the patient, again, with maybe different language, maybe different ways we're showcasing that, maybe not to the same depth, but that harmonization helps really the care team and the patient kind of work off the same playbook. So we do that on an annual basis. We are constantly updating our content over time. So there's monthly releases where the team is working on certain programs over that month, pushing that out, preparing for the next month of content and releasing that, sometimes 40, 50, 60 updates over the course of the year based on the needs of the literature. So I'll also say we often get the question, why do we use illustration in our multimedia programs? A lot of other tools use like live action or talking heads or things like that. We find that one of the great values of using illustration is the ability for flexibility and agility that it awards us. So we are able to come in, and if a key part of that procedure or the key literature changes, we're able to come in and update that one area, change that one word, update that voiceover, and push out a new program much more quickly than if we had to go into an OR and film, the change of that procedure. If the location of that cut is a few centimeters off, we don't have to capture that. We can just draw it basically. So I think a very real and very recent example of that is, I think we all remember this little thing called COVID, where over the course of every month or sometimes on a weekly basis, the recommendations from the CDC or others change. We were updating our content on COVID and COVID vaccines every month at that point. So, for example, if you think, at the early stages, we were told, oh, just cough into your hand if you have to cough. And very quickly we realized, well, that's a way of spreading germs. So you got to cough into your elbow instead, right? And so we were able to change that artwork very quickly and change the voiceover, so it's giving that direction. If you think the very early stage of the pandemic, we weren't recommended to wear masks a lot of places. And then quickly we learned that that was a way of containing the contagion. So we were able to come in and update those programs to show people wearing masks in most instances. So that's just a way that gives us that flexibility to be able to move quickly and with agility and stay, like you said, up to date with the latest standards.
So how do you build that human connection? How do you make your content kind of more real life and less sterile so it doesn't look like it was generated by an artificial intelligence?
Well, I do think that another benefit of a lot of the tools that we bring to bear in our content, illustration, real human voices for our voice artists, is very much focused on delivering that human connection. I think one of the things that we take very seriously is, as a creative group, we are people, we are patients, we are health consumers. And so we try to embed our empathy and our understanding of that experience into the work that we're doing. So for example, we try to, in our artwork, build that human connection and warmth into every scene that we can. If you think about trying to explain to a patient, it's so important to wash your hands for 20 seconds and sing the happy birthday song. I think we've all seen those little diagrams that are somewhat inhuman, of like top-down view of somebody washing their hands and the soap and bubbles, whatever. We try to spin it around and we show a little kid maybe standing on a step stool in the bathroom with his little stocking feet, and like washing his hand and looking at his mother in a loving way. The connection that a newborn baby and the first time mother has when after birth, and she's holding the baby there in the delivery room. We try to find these little examples of ways that we can build a human connection. A lot of that comes from the fact that we are all human. We use, as artists and creatives, we use our experience to help feed that. So another good example of that is we are creating a diagram of how to gauge the height of a child in the best way, how to get them to stand straight, put their elbows against the wall, so forth. So we showed like a profile of a little kid standing up, getting their height taken. And it turned out it was the artist's 5-year-old daughter that was the model for that diagram. And she was holding her little tiara and her princess wand in her hand while she was being modeled for this scene. And he drew that right into the program. So it's got that little like nuance and that touch of real life that helps just surprise and delight in some ways. And in a lot of ways, those little tiny touches just kind of bring down the anxiety for a patient. It feels like real life. It feels like real people. And it's not just this sterile diagnostic approach to delivering content.
Well, as a pediatrician, I rarely saw patients without tiaras. So I feel like you're doing a good job.
Pretty standard equipment.
You mean you wore a tiara every time you saw
Always.
patients? That's really, really nice
always,
of you, Craig.
Always.
Way to build empathy. Evan, we like to ask everybody this question at the end of the podcast, and that's to share with us 2 or 3 things, and they could be outside of healthcare, but 2 or 3 things that are so well designed that they bring you joy to interact with.
Yeah, that's a hard one for me because I am a design nerd, and I just love, I find things every day in my everyday life that really kind of delight me or frustrate me. So I'll focus on the delight first. I think I'd mentioned to you in our previous conversation, I have 2 littles at home. I have a 2-year-old and a 4-month-old son. So for anyone with kids knows, there really is a wide range. There's some really great design kids stuff out there, and there's some really poorly designed stuff. And as a parent, you find out what works well or what doesn't. So my 2-year-old, he just turned 2 a couple weeks ago, and we wanted to get him a present. And like probably a lot of parents these days, we're really trying to avoid like more screen time, putting him in front of a screen. So what could we do that keeps him engaged, gets him out of our hair for a little bit, and like allows him to use creativity and his love of storytelling as well to be able to engage with. So there's this brand called Tony Box. Tone in German is actually the word for sound. And so I think correct me if I'm wrong, but I think it's a German company. I've learned about this. I've seen it in Europe before too. And so what it really is it's a self-contained speaker that's indestructible. It's wrapped with soft, easy to clean material around the outside. It's got 2 little ears on it. It's got a little speaker coming through. And basically what you do is you get these little figurines that have a magnet on them, and you place them on top of the Tony box, and it plays a story or sings songs to you. There's a lot of Disney things. There's a lot of Dr. Seuss in our house. So there's Horton the Elephant is a favorite that gets played over and over again in our house. Through that, and they use RFID technology to basically let that little figurine tell the Tony box, hey, play this story or play this song. First, and another benefit of it is you can actually record your own recordings on it through an app. So I can, I'm here at the office today. I this morning recorded a little message to my son. So when he got up and was getting ready for school, he heard, hey, what's up, Henry? Hope you have a good day at school. Here's a song for you. And he can play that on his own. So it's really great content. It's all engaging with with their sense of imagination and so forth. But the UI and the design of the materials themselves are also incredible. It's indestructible. The ways that you interact with that box itself are so simple. So there's 2 little ears. You pinch one ear to turn down the volume. You pinch the bigger ear to turn up the volume. If you don't like the song, you get to whack it on the side, and then it skips to the next song. So for little kids, my son figured it out in 30 minutes, right? And so he is a master at using this UI of this device. And I think the takeaway I have is that how can you design for your audience in a way that's simplified, that's easy to understand, that surprises and delights and encourages them to be able to engage with that content in such a simple and clear and seamless way, intuitive way. So that's one. I'm going to kind of work up the age group here. 2 maybe is not a huge surprise. I will say, I have a brother that actually recently was honored to take a role at Lego in Denmark. So he is working at the headquarters as a set designer in Billund, Denmark, which is incredible. It's kind of a dream job for him. We grew up with Legos, and in my day, Legos were just a box of 15 different pieces that you dump on the floor and you build a dragon or a spaceship or whatever. These days, they have gotten a little bit more nuanced and complex. So, lo and behold, a couple days ago, a couple big boxes showed up on our doorstep. I popped those open, and it was a whole Duplo set for my little guys to play with, which was awesome. And then for me, it was I kind of cheekily told him, "Hey, I saw this." This special A-frame design set, A-frame cabin, if you can imagine that, from Lego. Looks really cool. And he just sent it my way. It's over 2,000 pieces. And really, really interesting design. I got to say, my skill set with Lego has waned over the intervening decades since I last played with them. So it was a little intimidating, but I actually got to sit down over the course of a couple weekends, popped open that box. The instructions are way different than I remember back in the day, but it's really like a co-creation, co-authoring approach these days with Lego, where they invite you. There's very specific directions, but you're able to kind of put your little touches on that design along the way. And the thing that really delighted me was, instead of building the whole structure and then maybe there's a little coffee mug or a canoe that you can put in there, they intercede these little details along the way as you're building it. So there's a little record player that goes in the corner of the cabin. There's a little frog that goes under the front doorstep that you can only see if you know exactly where to look. So that idea of storytelling through design and that co-creation process was just really wonderful. And so I guess I'm back to being a Lego nerd quite recently.
I love that answer. My daughter has 6 shelves of Lego kits that she's built and will absolutely not let us disassemble, but that she plays with like regular toys. So she got all the fun of building them, and then
it's a wild experience. Yeah. And if any other boxes show up on my doorstep, I'll let your daughter know, and she can she can maybe help me out there. So I think those are a couple examples related to childhood and imagination and creation that are really touching. I'll say for me, myself, one of the brands and one of the things that I really love, you might imagine from my A-frame cabin Lego, I really love the outdoors. I work in a digital healthcare space. We're on the computers all the time. We're creating things on computers all the time. I love to disengage and get out in nature and just like the joy of just quietude and just being out there and kind of enjoying life and nature is so important. So one of the brands I love and I really connect with is Filson. I don't know if you're familiar with that. It's outdoors brand from Pacific Northwest. I think they were founded over 100 years ago to like support the Alaskan gold rush. So it was all this like very rugged twill, really handmade, really crafted bags and jackets and boots and things like that. I have a bag that my father-in-law gave me that's maybe 30 years old or something. It still works like perfectly. And I'm sure that'll be something I'll hand down to my kids as well. But just that idea of craftsmanship, that idea of quality manufacturing is so great. And I think they do a great job of letting the market do the marketing for them. So they allow people to go out and use their materials and showcase the beauty and the action and the challenges they face out in the great outdoors using their equipment. And I think that's just a really wonderful way to connect with your audience, is being able to have that authentic, genuine storytelling that helps people make that connection. So bringing it back full circle, storytelling with an agenda, finding that way that really connects with your audience, whether that's a wannabe outdoorsman like myself, or it's a patient that's sitting there preparing for a procedure. I think finding that hook, finding that ability to connect in a really authentic way is so important.
Those are fantastic examples. Thanks so much for sharing, Evan. And thanks so much for being on the pod today. We really appreciate having you here.
I really appreciate the opportunity to be in here and talk with you this afternoon. I think design and thinking about how to meet patients where they're at and how to meet healthcare professionals where they're at is such an important topic. So I really commend you all for leading the charge and talking about these important areas.
Thanks so much. And yeah, we definitely agree.
Thanks for tuning in. We hope you enjoyed today's episode. For more information about Evan, visit wolterskluwer.com/health.
Check back for more episodes of Designing for Health wherever you listen to podcasts or on nordicglobal.com. Till next time, we'll see you in network. If you enjoyed this episode, please leave us a 5-star rating and a review. This helps others find the podcast as well.